Good afternoon, everyone. Thanks for joining us today for our educational webinar on telemedicine, practical tips on how to prepare for appointments. My name is Gabriele Colasurdo. I'm the Manager of Education and Patient Services at Myeloma Canada, and I'm happy to be here to listen to this talk and to host this talk on a topic which I think is very relevant in what we're going through right now, and I think moving forward. So, but before we get to our presenter, I just wanted to say a few words. Thanks to our sponsors for helping us out, for making this possible. It wouldn't be possible without them. So thank you to Amgen, Binding Site, BMS, Janssen, and Takeda. Right before we start, I wanted to just let you know our next webinar is going to be on Friday. It's going to be at 1 o'clock Eastern time on drug interactions in myeloma and how to avoid them. We have a pharmacist from Hamilton, Ontario, Al Harith Mohammed, who will be giving us that information. So I hope you're able to tune in for an hour or so. I know that the weather is really nice, but hopefully you can take a little break from the sun and come and listen to us. If you can't, all our webinars are recorded. They're all uploaded onto our YouTube channel. So on youtube.com, if you type in Myeloma Canada in the bar, you'll be able to find our channel. You can subscribe. Once you subscribe, you can also have the option of getting notifications every time that we put a new video up. So that's a good way to stay up to date with the latest videos. From our website, myeloma.ca, you click on the resources tab. The menu will open up, and then you click on educational videos. That'll also get you to where you want to be with the webinar videos recordings. Lastly, how do you ask questions? So your audio is muted right now, so you're not able to ask questions verbally, but you can type them in. I will receive them, and then I'll have a discussion at the end with the questions that are all submitted. And so whether you're using a computer or a tablet, there's a question function. You click on questions, you type in your question, you click on send. I'll be able to get those and ask our presenter about them. So without further ado, I'd like to introduce you to Dr. Beth Faiman, who is a nurse practitioner at the Cleveland Clinic Taussig Cancer Institute, and she's also part of the nurse leadership board from our colleagues at the International Myeloma Foundation. And so, Dr. Faiman, thank you so much for accepting our invitation and for taking the time this afternoon to come teach us a little bit about telemedicine. I know that it's something that you've been doing for a while, and I think with the pandemic going on, it's something that at least an element of it is here to stay for moving forward.
For sure. Thank you. Can you hear me okay, Gabriele and everyone? Yes, thank you. So I am so honored to be invited to present today on telemedicine. My husband is from Winnipeg, Manitoba, and we frequent Canada. We have friends in Toronto, and I was most recently in Montreal about just before the pandemic. So I love Canada. And also my husband is director of telemedicine, so he goes up to Cleveland Clinic Toronto from time to time as well. I'm fortunate to, through him and through the Cleveland Clinic, have been using telemedicine. Just a brief discussion about my background in myeloma. I started working for the Cleveland Clinic in 1994, and I started caring for those patients with myeloma just shortly after. I have been involved in the management and research with myeloma therapies and patients for many, many years now, pretty much since I started my career. So thank you very much for having me. Let's talk today about practical tips for preparing for telemedicine. Hold on, my 10-year-old son just turned the lights off. Man, sorry, this is working from home, what happens. So anyhow, I just wanted to share with you about this idea of online and virtual visits. So Canadians access the internet just about the same, if not more, than people in the United States. 90% of Canadians, when last surveyed, have access to the internet. This is an important and critical piece when you're talking about telehealth services. How are you going to access those services, and do people have access? And the answer is most people are. And then the next question is, are Canadians capable of accessing, even if they do have access? And what percentage of older individuals are able to surf the web or the internet? And as of 2019, 57% of people ages 55 and older were able to access the internet, compared to 24% in 2015. So these numbers are continuing to increase as different areas are having access and landlines and such. Also, nearly 3 in 4 Canadians spend about 3 to 4 hours a day online. Now, these are before the pandemic. Who knows how much increased our screen time are with the Zoom meetings and finding virtual ways to connect. I know I've done a lot of Zoom meetings myself. The next few slides will focus on the benefits of virtual care. So telemedicine is when you seek telehealth services from 2 different locations. And many of us are probably very well aware of the virtual care benefits, but to specifically the Canadian health system, much research has shown that it provides earlier access to health care. You know, oftentimes you're waiting days and weeks to see the provider. Now, when you're able to access it, you're less sick when you're actually seen. It reduces the avoidable in-person visits, and there are fewer sick days taken away from work. There's also benefits of virtual care to clinicians. We can see patients anywhere. I can see patients from a secure office. I can see patients from my actual office, and we can access patient history through asking what your history is in many cases as well. There's also further benefits of virtual care to patients in terms of Canadians specifically. Less than 50% of Canadians can get the same or next day doctor appointments at a recent 2019 survey, and 33% of all Canadians wait 6 or more days to get a family visit appointment. And these are just striking numbers, because think about, as a myeloma patient, if you're having an urgent need but don't want to go to an urgent care center, this virtual care and express visits will provide a way for you to connect a little bit earlier. You can also skip the long lines in the waiting room. If you're feeling sick, you have the flu, you have the COVID concerns, you're not getting other people sick. And I think that's a critical piece we highlight in my practice. When you're sick, you probably should be seen, but you can be seen virtually. We'll talk about how to do that as well. So there are many different services in Canada. This was just a quick study I put up about the New Brunswick Health Care survey, looking at the ability to get an appointment within 5 days, ranges from 19% to 75%. This is last year. And now we have newer information that based on the telemedicine, you can get quicker appointments. And these were surveys that started in 2011, and 13,500 citizens each time had responded. And we're eager to see the final numbers for the 2019 survey. There's also benefits of virtual care for employers. When you are at home, when you're at work, you can log into a teledoc system. There's many different ones depending on your province. And it can decrease costs to Canadian employers. A recent survey from 2019 showed $16.6 billion saved per year by people not having to go into what we call brick and mortar, which is like a hospital building. And then these are just some statistics about the absences due to family care and saving sick time. So there are many ways to connect. I'm part of Cleveland Clinic, as you heard. I've been there since 1994, and I'm very supportive of all their services. I'm fortunate to still be an employee there, and we have a model called Cleveland Clinic Express Care Online. In Ontario, you can access this through a flat fee for your entire family and have on-demand services whenever you need them. There's other services such as Teledoc, Maple, Ontario Telehealth Network, livecare.ca, there's you name it, there's lots of different private services. And in 2018, I put a screenshot. There was an article about telemedicine was on the rise, but still lagging in Canada. And of course, last month we had a paper that talked about how the coronavirus has sped up Canada's adoption of telemedicine. And there are people that want to make this permanent. And you know what? I'm one of them. I like the convenience of people not having to leave their home and still connecting. These are just some other benefits. Fast and convenient. It's usually a secure connection. And that peace of mind of maybe you're not sick enough that you want to go out of the house, but you're not feeling well, just taking a moment to connect with a provider such as a nurse practitioner like me, or a physician, or another nurse. We have lots of nurses that conduct telehealth services in the US and Canada, can kind of put your mind at ease, maybe more so than a phone call. One of the biggest questions, and I educate doctors all around the country and nurse practitioners on how to perform a virtual physical exam. You think there's no way they can examine me, but the answer is yes, you can. You'd be surprised what you can hear and see over their smartphone or device. When I have patients in my room, and we'll talk in a moment about how to prepare for the exam, I'll have them go right up to the camera and look at your tongue. They can shine a light. I can look in the back of your mouth. It can help me by feeling on the side of your neck if you have swelling in your neck. All these other things we'll talk about as well. And you know what? It can help us in this limited exam prompt you to say, hey, maybe you do need to have blood work taken and be seen in person by your concerns. And that's what I think the virtual exam is very useful for. At the bottom of the slide, I have highlighted 2 testimonials from patients of mine. One said once the camera was on the laptop, was brought down, that I could see him. It was almost as if we were meeting in person. And if you've ever FaceTimed a friend on one of your smartphones, I think that allows you to feel connected. Another person said, I was a little skeptical about my first visit being handled by video, but after the conference, I was very pleased. So you can go on and on about testimonials. This is my husband. I had to put his picture on a slide. He's the face of telemedicine for the Cleveland Clinic. He's director of our Express Care Online, and I just love him to pieces. So there you are, Matthew. You're in the Myeloma Canada. He's very jealous, I'm sure. So what to consider before your visit. I did go on and on about the different background of telemedicine because I think it's important to know who has access to the telehealth visits services, why we should do telehealth in the first place. And there are 2 main areas when you're considering a telehealth visit. The first should be the type of technology you use. We'll discuss that in a minute. And then finally, treat this as a regular visit. Have questions for your provider written down, and we'll talk a little bit more about that in a few minutes. So first of all, if you decide you need a virtual visit, let's say you're supposed to see your provider in follow-up for your myeloma. You are on Revlimid maintenance to keep you in remission after you had a stem cell transplant for your myeloma, and you just need a checkup. Those can now be scheduled. So if you were at the Cleveland Clinic, and I know many centers across Canada from the east to the west will do this as well, they will send you instructions by email about how to connect with your iPad, Android phone, iPhone, computer, whatever. Smartphones and iPads are so nice if you're fortunate to have one, because you can really take it, and I'll ask you if you have your smartphone to put it down by your legs so I can look to see if you have any swelling. I'll ask you to press on your ankles to see how bad the swelling is. We can do a lot more with the physical exam if you have a smartphone. So also the camera is a lot better and the microphone's a lot better than many of our computers. So in terms of the technology, like I said in the introduction letter that many of the services will send you, they will send you an overview of what to expect, how do you set up your app or your computer for the appointment, and then what to do on the day of your appointment. This was accessed in a this was accessed in a Cleveland Clinic patient handbook, which has about 10 different pages to it. It's online if you'd like to look at it as an example, but Teladoc and other services have their own handbook. I just put mine up there. Other things, find a quiet, comfortable space that's free of distractions. I see a lot of people in my visits are sitting on the couch, putting their feet up, just relaxing, especially if you're worried about having to wait. At least you're not waiting in a doctor's office, you're waiting on your couch. Now, locate and check the links before the visit. Much like logging onto this meeting, you wanted to make sure you had the proper link. Locate and check the links for your visit and check the time of your appointment. Find out if there are any costs to the visit. Till June 30th across many places in Canada, a lot of the telehealth services fees have been waived. Of course, now it's June 23rd, so you have 7 days to access that, and that might be extended, it might not. But find out what your costs are. Usually they're about $40 to $50 per visit, depending on the service that you're using. And sometimes that fee can be temporarily waived if it's COVID related at this time. Many of the services will ask you to click on a box to accept the type of visit before they'll let you in the room. And sometimes, depending on the portal, you might not see that very easily. But try to relax. You know, office visits can be so stressful. You're worried about your myeloma, and now you're worried about what you're going to be told over a camera. Am I relapsing? Am I in remission? There's so many uncertain things. And so just try to relax if you can. But televisits are no different. Familiarity with the technology is important, though. So connecting virtually, as I mentioned before, and I think that's a very important theme, connecting virtually is very important. Now, it's hard to read this, but I pulled this out of the patient handbook on the Myeloma Canada website. I think you all have wonderful resources. I work, as you heard, with the International Myeloma Foundation, and from 2006, I'm a founding and lead member on their nursing board. And oftentimes I like to refer to your resources because they do support being your own advocate. So while you can't read these on the screen, I put the link at the bottom of here, and this is in Chapter 9. All of these very important things that are listed in Chapter 9, you can use for your virtual visits, such as keeping a diary of your symptoms, keeping a list for your questions. So anytime you have a question, you say, oh, I have to remember to ask Beth, so you can run to your log, keep it by your phone or in your kitchen, and then jot down your question. So when you come to your visit, in that time you're there, you're prepared and not worried about forgetting something important. If you're experiencing fatigue, talk about rate from 0 to 10, how bad it is and what you were doing the day before or what you ate. Keep a pain log. So all of these things are very, very important and should be done in preparation for the virtual visit. So we talked about why to do virtual visits. We talked about the importance of knowing the technology and how to connect. But the next few slides will be talking about before you sign on in the actual day of the appointment or a few days before, make a list of questions. I tell my patients for every visit, when you come back, I want to see you with a notepad to take notes and ask me what's important to you so that you're not forgetting things. So ask about your blood work, imaging or other tests, how to interpret them. Review with your provider the medications that you should be taking, the ones that you are, and ask questions if you can take other things like supplements. Are they safe for you? Discuss concerns such as side effects of therapy, anxiety, trouble sleeping. All of these are very important and should be discussed in virtual and live visits. Before you hang up, plan to make a note to confirm the future appointments. How will they be scheduled? And also, if you've never been to the Myeloma Canada website, don't hesitate to go there to look at the different resources that are on there. One of the things I like is the treatment options. It's very clear what you can receive in the different provinces. It's so varied. And so if you're worried about relapse and next options, you can educate yourself about the medicines that might be available to you. So there's my husband again. But before you actually sign on, eliminate distractions. You might be on the couch, but turn the TV off so you can hear each other. It's okay to have friends and families and caregivers and significant others join you. It's so nice to have another set of ears during these office visits, and it's also nice when you're on the video. Have that pen and paper handy to jot down any notes or further questions, and then you'll log into your visit. So when you're connected, just like when you connected to this meeting, to say hello, make sure you can hear and see each other. Sometimes I have patients go on and they're talking and I'm trying to communicate with them that I can't hear them. So then I pick up the phone and I call them while we're on the connection and we can get aligned that way. The provider should discuss with you what to expect during that visit. Everybody has a different process. The provider should also walk you through the physical exam and take their time. We get usually 15 to 30 minutes for a virtual visit in my place. And what's so nice is that you can really take that whole 15 to 30 minutes. We talked about jotting down your questions, reviewing labs, and you'll have that ahead of you. One of the things I also do when I ask people to do this physical exam, if you have a blood pressure machine or a temperature thermometer or can take your pulse, take that before our visit, and so you'll have that to share with me. I'll take your word for it if your blood pressure is normal or if your weight's normal, but those informations are super important. Down at the bottom of the slide, I have a couple links. I actually, to the right, I discussed with nurse practitioners and physician assistants how to conduct a physical exam. So you can watch a video of me telling this other girl how to be examined. So a lot of the other Teledoc and OTN and other networks that provide telehealth in Canada have these similar resources, but just for fun, if you wanted to see that, you can. To the left, you see a gal, she's pulling her eyes down. We can see if you have yellowing in your eyes. If you're having sinus, you can pull your ears, and if you have pain, it might actually be a sign of sinus infection and something real concerning. I'll ask people to come up to the camera and just be quiet so I can listen to you breathe and make sure you're not in any distress. If you're having belly pain, I can tilt my camera down. Sorry, you can see I have shorts on and a tank top underneath my jacket. You can, I'll ask you to press on the belly and I'll watch to see if you're jumping in any pain. As I mentioned before, I'm on a laptop and I can't do it with this device, but I'll have you stand up and walk around the room and carry me with you so I can see how you're able to walk if you're unsteady or if you're steady. If you're having back or shoulder pain, I'll ask you to reach your arms out over your head and in front sometimes. And so this is just a limited exam, obviously, but this is all very important stuff to make sure that you're continuing to be healthy and live well with myeloma. So now you know that you can perform a physical exam. You know it's important to be able to access this technology. One of the biggest problems is cost, though. It's really expensive to seek health care, and out-of-pocket costs of myeloma are so high for many people. In the United States, we do have some programs to offset the cost of these telehealth visits. We do have some insurances to supplement. And now I know various provinces are recognizing the benefits of telehealth, and so there are some decreased costs in Canada depending on where you live. So ask your provider if this is an option, especially during the pandemic, and this is not going away. I'm thrilled to see the very, very low rates of infection other than Ontario in Canada. And I hope you open the border soon, though, because I'm supposed to be going to a cabin in the border of Ontario, Manitoba in August. So hopefully you'll open the border, but I know you want to keep us Americans out. But remember to try to de-stress, stay healthy and active by taking walks outside. And you know all of the things that have been on the news. Wash your hands, wear masks in public, and eat your veggies. There are lots of healthy antioxidants in the colored vegetables such as carrots and leafy greens. And don't forget to try to connect virtually, because I really believe that in many cases you can form a connection and it can make you feel like you're in the same space. On this slide, I have listed a screenshot from Myeloma Canada, of course, with great resources. Fortunately, you have all created virtual support groups, which I think is wonderful for caregivers, for patients, and young patients as well. And so there are various links to these virtual support groups. So you will be able to stay in touch with others during this time. So in conclusion, virtual visits can produce anxiety from connecting in the technology, what happens if it doesn't work, to what kind of questions or what kind of answers am I going to get from my provider about my health. But at the end of the day, on demand and in person are all good ways to see each other, to monitor your health, monitor your disease, and keep you living well longer. Treat these visits like you would regular office visits. Don't be afraid to jot down questions and ask those questions and bring those concerns to your provider or have a caregiver speak up on your behalf. I think that's all I have. Thank you for listening, and I'm happy to answer any questions if you have.
Thanks, Dr. Feinman. That was a great overview of telemedicine, and I also thank you for referring to our website and the resources. It actually made me think that we do have one resource which we it's called the Myeloma Monitor, and that's it's kind of like the Myeloma Manager
Yep.
that people have been using, and it's a Canadian version. And you can do all that stuff, tracking your blood tests and your pain and your fatigue, all from the comfort of either your computer or your phone. Um, the other thing about the support groups, yeah, we have some Facebook support groups, but the other thing that we've done at Myeloma Canada to help out during this time is we've given Zoom accounts to all of our support group leaders. That way, support group meetings, although not in person, might not be possible, but through Zoom, still being able to communicate with people who are going through very similar situations. Um, and so that we're basically we want to make it as easy as possible to help people living with myeloma live with myeloma and still get the support that they need. Um, Now we do have a question here, but actually, I guess before I get to that question, I have a question. We talked about what telemedicine is useful for, but under what circumstances might telemedicine really be like, okay, well, no telemedicine. You need to really come in.
That's an excellent question, and I should have included it ahead of time. We have a list of conditions that should not be seen by telehealth. If you're having sudden shortness of breath or chest pain, then you probably should be seen immediately. If you have a fever over 102 Fahrenheit or 39 degrees Celsius, that should also be seen immediately. So any breathing, any heart, oops, sorry, I did that wrong, or maybe you did that, I don't know. There you go. Maybe, I don't know if this was the proper slide to put up.
That's fine. This one's fine.
Thank you. So anything sudden and concerning, so those would be considered emergencies. Shortness of breath, chest pain, severe abdominal pain, those should go to an urgent center or should be seen in the office. So I'm fortunate at my institution, we have a way to get people to avoid the emergency department. And so there's a number to call, and it starts at like 7 in the morning until like 5 at night. And you could avoid the ER. We could do a lot of what the ER would do in our cancer center. We are unique, but that is another option. It's just so hard to avoid the emergency department sometimes, but that's the appropriate place for a lot of people.
Thank you. Yeah, that makes sense. So the question we have here is, with the pandemic and all, not that it wasn't important before, but a lot new mental health concerns have been raised. With everybody, whether you're a myeloma patient or not, mental health really is taking center stage. And so, on a telemedicine visit, what kind of questions do you use to kind of evaluate the mental and emotional status of someone living with myeloma?
That's a very, very important question. So before all of our scheduled visits, we have a questionnaire before patients log in. And I didn't include this because not all centers do that. And it's a questionnaire to assess for, are you suicidal? Do you feel like you want to hurt yourself? Are you depressed? Do you cry all the time? So there are similar questionnaires you would be answered in a live space. We put that up on the televisit if it's a scheduled televisit. So you can kind of see from people's demeanor. I'm always asking people how they're coping with things and let them talk. But the questionnaire gets answered ahead of time before they come to me, and I review those answers. We have social workers that I can set them up with if they are at risk, and then I will align them with mental health resources as well. But the isolation that people are experiencing is just unfortunate because people like to stay segregated. Many people don't like to socialize and go out, but then it can become really, really severe. So I encourage people to, the caregivers to check on others and And we have nurses that can also reach out as well. And again, the social workers are helpful. If I think somebody's at risk from knowing them before, I will have them check on them again as well. But there's just not enough people to help out, unfortunately.
Thank you. So staying with the same theme of mental health, um, in your experience, does telemedicine kind of hurt that evaluation or hinder it in any way, or is it totally doable by telemedicine?
I actually think it can help because of the fact that when you're in a sterile environment in an office room, a lot of people will be afraid they're going to admit me to the hospital if I tell them that I'm very, very depressed. And if you're in the comfort of your own home, in your comfortable chair, and you're not in a hospital environment, you can sometimes have more rich and valuable conversations with people. And so I don't think that yes, I would like if I have to deliver bad news to somebody about their relapsing and we have to change treatment. I have had those discussions and those are always very difficult. Fortunately, I have formed a connection in person with people before the telehealth age in many cases. Do I see new people as consults in telehealth? Yes, and those are always challenging too. But when you have somebody that's very depressed or anxious or scared, sometimes it's easier because they are at home in their safe space.
Thank you. So then the next, actually, we have a comment here. Excellent presentation, some very useful information. Thank you so
Thank
much.
you.
That's always nice to hear that. Um, the the when you're in the doctor's office, a lot of times the doctor's or nurse's office, a lot of the advice is, sometimes you should take down notes or record the conversation. And so with telemedicine, is there any kind of recording function? I know that it may differ between institutions, but do you have something that you can go back to and if you missed anything during the appointment?
Yeah, absolutely. So in the Cleveland Clinic, and I know a lot of other offices are like this. In the Cleveland Clinic, we have a electronic medical record, and I create a note from our visit, and I type out what their concerns were, what their exam was, what the medication changes, if any, that they've had, and what our next steps are for follow-up appointments, et cetera. And so that gets emailed to the patient afterwards. And so you can also, and I've recommended to patients, if you do log in by computer, you can record on your phone, or if you log in by your phone, there's a way that you can do a record screenshot function. And so I've coached people through that if they had wanted that. But otherwise, for privacy purposes, Zoom has the capability of recording for future, but other preparations and platforms might not for privacy purposes. But yes, so I type up things and I send it to the patient afterwards so they have a summary of what we talked about. And it also will include what treatments they had, what worked, what didn't work, and all those other things for future.
Thank you. Yeah, thank you. That's a good explanation. So I think this might be the last questions. Please do send them in. We'll be happy to. We still have a little bit of time. So this question, someone in Canada, well, because we're talking about telemedicine, I mean, I guess there's nothing stopping a Canadian from going to, let's say, a provider in the United States, for example. And so someone simply is asking is it possible to get an appointment with you somehow? What channels do you need to go through? Is there somewhere online you can go to potentially get an appointment with you?
Yeah, I'd love to see anybody who's interested. So that would be, we have a cancer answer line through the Cleveland Clinic, and they could just call the 1-800, it's 223-2273, and then they schedule an appointment, and that would be like a virtual consult. And it's a flat fee of like $40 or $50. It's not a lot of money. Well, it is a lot of money, but for not having to get in your car and drive across the closed borders, then that should be fine. There are some limitations in terms of prescribing things. So there are, in the United States, we have very clear laws as to who could prescribe. And it's, even though I'm seeing you in Ohio and you're on my screen in Ohio, I still might not, I won't be able to prescribe, but I can provide recommendations about your history and your case, and review all your lab values through the Myeloma Manager. I know you can upload some labs in there on your website, and there might be other portals, but yeah, so that just our Cleveland Clinic Cancer Center Cancer Answer Line is what I refer people to. And also you can always send me an email for a consultation. But yes, we routinely are. I think that now with the pandemic, we're getting so many people from across state lines. Not as many because people are worried about what's going to happen afterwards, but it's been nice to establish connections from people around the country, more so now. But thank you for your interest.
No, thank you, Dr. Faiman. So with that, we have another comment here. Another thank you. Basically, that you had mentioned that if the physician has time, since sometimes patients might or people living with myeloma might feel like they're rushed, because the doctor's busy or the nurse is busy, and we need to get in and get out kind of thing, and it's important to take time for these type of things.
Mm-hmm.
So we don't have any other questions.
Yeah,
So
can I just make a comment
yeah.
along those lines? So I have been doing, usually I'll see 18 to 20 patients a day in my clinic. All of them have multiple myeloma or smoldering myeloma or amyloidosis, all plasma cell disorders. And I rather enjoy the virtual visits because that 30-minute time slot, maybe you'll have to wait 5 or 10 minutes from me, but you're in your home and you're not just sitting in an office. And then I will add that on, and we really do get a full 25, 30 minutes together. And I think that they're a lot more relaxed. You're not having to check in and take vital signs and fill out paperwork. And so there's a lot less stress on behalf of the patient. Sure, the technology causes stress, but driving into the downtown city to see me in Cleveland, people say I'm much more relaxed, not having to worry about waking up, driving in for my appointment, and then having to go through all the channels. So there are so many benefits. And I know that I have now the pandemic in Cleveland is really calming down. Hopefully it doesn't spike up. I have people that say, do I ever have to see you in person again? Because I really think that I think, well, they tell me that we can connect together and you have a conversation, and it is a little bit more relaxed for many people. So
Yeah, and you had mentioned, oh, hello, and you had mentioned that the cost of $30 to $40, it's money. Definitely, it's money, but at least in Quebec, where I'm from, if I wanted a doctor to come to my house, just to do a basic checkup, it would cost me probably at least $120 to $150. And so when you compare the two, what are the pros and the cons, then $30 to $40, but you still get a checkup and still possibly also get prescribed something, then that's okay. So we did get more, since you were from your last comment, we got some questions. This one's more of a general question, not really to do with telemedicine, but since we have you, might as well ask you on some strategies dealing with the side effects of steroids. Not being able to sleep, diarrhea, feeling of I guess, for lack of a better word, stoned.
Yeah.
Maybe you can share some strategies.
Absolutely. So when I started practicing myeloma, we used to give steroids the high dose. It was the 40 milligrams days 1 through 4, 9 through 12, and 17 through 21 in the month. You took 360 milligrams. We learned in 2010 by a study, and Dr. Raj Kumar led it. It was from a support group member that said, how do we know this is the right dose for steroids with our new medicines like Revlimid? And so that study showed people lived longer and had less side effects such as pneumonia and infection when you had the less once a week side effects. And so now we use a dose of 40 milligrams weekly by mouth for people that are under 75. And if you're over 75, you get 20 milligrams. In my practice, I do pay close attention to the side effects. So if you're having insomnia, I try to talk about strategies. Taking the medication at bedtime can actually help you. You don't sleep as poor the first night, and maybe only one night instead of 2 nights are you having problems. The eating can be an issue, and being hungry all the time and hyperglycemia. So we talk about healthy food choices to snack on. Even though you're craving sweets, try to make sure that they're healthy sweets or fruits. And then the other things, such as the just feeling jittery and all ramped up, I really am quick to cut the steroids down to 20 or even 10 milligrams once a week. Our newer medicines are so effective that you do not need all those steroids anymore. So talk with your provider. Do I really need this dose of steroids, or can I try a shorter dose? And then we can get down for some people to 1 pill once a week, and that is just enough to marry with the newer therapy. So have that conversation about the dose. We always dose reduce if there's severe side effects, but have that conversation about, is this right for you? Now we have medicines that are coming out that you don't need to use steroids with at all. There's one that's going to be approved in the United States at the end of this year, and that will require no steroids. Daratumumab, I think, is now approved in Canada, and that's an IV monoclonal. And many studies are now saying you can take that steroid away after the first few infusions. It might actually be better for the myeloma. So have that discussion, and hopefully by stopping the steroids or reducing the steroids, if that's right for you, that might help. But never stop on your own.
Yeah, definitely. Always listen to your provider. So I'm not sure you're able to answer this question, and so I suppose in certain provinces, you're able to get followed up only once a month, and so if that follow up once a month is by telehealth, and it's decided that okay, you need to go in for an in-person meeting or in-person visit. How does that work exactly? Can you do more meetings in a month even though it was like telehealth?
So to gather insight into Canada and what the rules are with telemedicine, I did have a discussion with my husband, who knows what goes on in Ontario. Unfortunately, that's the only one that he has knowledge on, a little bit in Manitoba. But so there are registered nurses who can triage side effects by phone. And so that phone visit would not be charged to you. That would also be a telehealth way of communicating. So you can place calls into your provider's office, and that might be the way that you can find out if you need to be seen. In the Cleveland Clinic, unfortunately, or fortunately, there are no rules as to how often you can be seen. If your condition warrants it, then you can be seen even daily. Not that anybody ever wants to see me daily, but the virtual visits are a way to manage side effects. For example, there's a new medicine called selinexor. It's a pill. It is very effective to treat relapsed myeloma in some people, but there's a lot of weight loss and other side effects such as low sodium. And I bring people in twice a week. Once is a telehealth visit, and then on the Wednesday or Thursday, they'll come in for fluids and blood work. And so you can do it. I'm not sure. I would ask your specific plan in your province, what is allowed per you, but I think that is manageable, and a way to get around that would be maybe a telephone visit rather than an actual video virtual visit.
Yeah, that makes sense. It's basically have a discussion with your healthcare provider on what's the best way to move forward.
Yes.
Yeah. So with that. Another thank you. Thanks so much. It was that was great. Great presentation. It's going to live on YouTube, so if anybody who missed this they'll be able to go back and see it, and I'm sure we'll get a lot of views as time goes on, and as telemedicine slowly creeps its way into the standard of care for everyone in Canada. So thank you for that. And before I let you go, I just wanted to remind everyone our next webinar is on Friday, June 26th, on drug interactions and myeloma and how to avoid them. So Dr. Faiman knows how important it is to avoid these things, I'm sure, and yeah, and so it's a good opportunity to learn more about that. So thanks again, Dr. Faiman. Have yourself a wonderful afternoon and evening, and I hope to have you on for another webinar in the future.
I would be my honor. So thank you. Don't forget to ask.
I will.
Have a great day.
You too. Thank you. Bye-bye.
Bye-bye.